Hello there and a very warm welcome back to the show. Georgia Tolley here, the agenda on Dubai Eye 103.8. Now, the quality of cancer care in Arab countries has developed at a very different pace. Obviously, here in the UAE, we are lucky enough to attract even healthcare tourists, such as the quality of doctors and facilities. But what about in other countries, from Saudi Arabia to Syria? Joining me now to discuss the evolution of cancer healthcare provision is Professor Humaid Al-Shamsi. Now, he is president of the Emirates Oncology Society and professor of oncology at the University of Sharjah. And he has recently co-authored a book called Cancer in the Arab World, which is one of the first not global, but the first Arab studies into the status of healthcare provisions here in this region. And he joins me on the line now and on Microsoft Teams. Hello there, sir. How are you?
Hi, thank you so much for your invitation.
Oh, it's a pleasure to speak to someone of your expertise. Tell me a little bit how long this book was in the writing, because if you're exploring the whole of the Arab world, it must have taken some serious research.
Well, it started actually March 2017, exactly 5 years ago. And I didn't even know at that time the project will start from a scholar paper, a project for me to understand the landscape of cancer care in the Arab region to become a book. But certainly the journey was very fulfilling and exciting, and with more than 50 authors from across the Arab region collaborated with us to come up with this book, which has been downloaded more than 70,000 times over the last 7 days or so after we launched the book. So the project started as a small project, but certainly there are so many aspects about the cancer care in the Arab region which has not been explored before. And we put together this more than 480 pages of science and data at the fingertip for anyone who's interested in this sector, which is the cancer care in the Arab region. This
is the question that we all want to, everyone listening to the radio right now wants to know. How did the UAE fare? Does it have a good cancer care offering?
To be honest with you, I could be biased by saying that, but the UAE came actually one of the top countries in the region for many, many reasons. Number one, the UAE government is very committed toward the cancer care in the Arab region and the UAE. Also, the UAE actually funds many medications for the citizens, and also many expats, they have full insurance, so they are covered. We have many countries, actually, they have challenges to provide their patients with the cancer care because the increasing cost of the medication that's happening in the last 10 years or so. So the UAE did very well. They are attracting top-notch oncologists and physicians in the field of cancer. They are building also top-notch facilities that, it's across the UAE and easily accessible to everyone who's suffering from cancer.
So I actually have a small personal sort of experience of this situation, because my son you don't catch cancer, but he developed Burkitt's lymphoma, which is a type of cancer, when he was 2.5, so about 4 years ago now. And at the time, there wasn't a unit here in the UAE where he could be treated. It's a very curable cancer. We were very lucky. So we needed to go back home. We basically went to Great Ormond Street in the UK, where he had his chemotherapy treatment over a 6-month period. And then after a few months after that, we came back to the UAE. By the time we got back to the UAE, they had the facilities here that would have meant that he would have been able to have the treatment here. So that just to give you a sense of how quickly the landscape changed here in the UAE. That was about 4 years ago, and within an 8-month gap, they didn't have a sort of pediatric cancer unit, and then within 8 months they did. Is that typical of the speed at which the healthcare provisions are evolving in this country?
100%. And in fact, there are at least 5 different pediatric units right now in the UAE. And also the UAE is also now providing bone marrow transplant, which this didn't happen more than 2 years ago before the COVID-19 pandemic. But currently we have multiple providers for bone marrow transplantation in the country, which is certainly a very critical component for cancer care for patients.
So does that mean that the UAE is now attracting tourists, medical tourists, from the rest of the Arab world? Not just for, Botox or cosmetic surgery, but also for quite serious treatments?
No, certainly this is not true. In fact, we have so many patients coming from Africa, from the Arab countries, coming to UAE for medical tourism for specifically cancer care. Again, there are so many things, making this happen. I'll give you a very simple example. Last summer, one of the medication which was approved in the US for lung cancer, without mentioning the trade name, it was approved in the US and it was approved in the UAE within a week after. So many people who needed this medication, instead of going to the US, they came to the UAE. And again, this is very critical when you have, access to, very important medications immediately in the country, which supports the vision of the country to attract people to come here for treatment.
That's really interesting because that means that there's a body here. It's called NICE in the UK, NICE. I actually don't know what the name of the body is here. That they're analysing the research about the medications very, very quickly to say whether or not they're allowed to be given in the country. Do you think is that a sort of push from the government to get these things sorted and analysed quickly?
Definitely. I mean, the Ministry of Health in UAE, actually, they play a very important part in that. And actually, they are very active when there's any medication, not only in cancer, and any other facilities, subspecialty, for example, cardiology or neurology. And this medication is beneficial for the patient. It gets, approved in no time. And this is a very important advantage for the patient because some medications in UK, for example, the NICE, they reject them because of their cost, but in the UAE, this is different. Certainly, some of the medication are very expensive, but we always look at the patient benefit at the top of the priority.
Keeping you updated and informed.
This is The Agenda with Georgia Tolley
on Dubai Eye 103.8.
Hello there, welcome back. We are in the midst of our conversation about the changing face of cancer care in Arab countries. We are joined on the line by Professor Humaid Al-Shamsi, who is President of the Emirates Oncology Society and also Professor of Oncology at the University of Sharjah. And he's also co-author of the book Cancer in the Arab World, which has very recently been published. Thank you for staying on the line, so I appreciate your time.
Thank you.
Now, tell me, is cancer a particular problem in the Arab world? And in that context, I mean, is it more of a problem in the Arab world than, for example, in the Americas?
Well, actually, when you look at the numbers, the number of cases or incidents of cancer in the Arab region is lower than the US or the Western countries, including the UK. And there are so many, factors behind this. But also, is it a big problem? It is still a big problem because it's the fourth leading cause of death in the Arab countries. And if we can be specific, it's the third leading cause of death in the UAE. So it has a huge implication about the society and also the risk of death. So, yes, it is a big problem, even though the numbers are not as much as in the other countries in the region.
I mean, we established in the first part of our interview that we're lucky living here in the Emirates because the UAE does have a very good service, cancer care, health provision. What other countries in the Arab world are similarly well provisioned?
Saudi Arabia, for sure, comes at the top of the list, actually, with the very well-developed countries when it comes to the cancer care and medical services. Also, we have Jordan and also Egypt. But Egypt's problem is it's a big country, so some areas are actually very well advanced in the cancer care, while others, they're still struggling with the basic needs. So there's a huge variation, but certainly Saudi Arabia comes at the top of the list as well.
So one of the things I noticed when we were in Great Ormond Street, when my son was unwell, was because the health insurance company had paid for us to go back to the UK and have his treatment there, we were actually on the private ward, which of course in the UK is a slightly odd feeling because we all get used to the NHS there. And I was actually we were the only British family on that ward because everybody else was from Kuwait. And it was actually during Ramadan, and it was rather lovely in some ways because I was missing home in Dubai and, everyone was celebrating the holy month. So I sort of felt at home in two senses of the word. But what was so interesting was that there were so many people who were essentially from the Arab world treating the UK as health tourists. Essentially, they'd come to Great Ormond for this Ormond Street Hospital for this cancer care for their children. Does Kuwait not fare very well in this list? Or was that my tiny little bit of anecdotal evidence completely inaccurate?
No, in fact, actually, your observation is 100% correct. And I'll give you the other aspect of the cancer care in the region. The government actually in the Gulf region, they do support their citizens if they wish to travel abroad for treatment. And this could be a little bit problem for many, because patients, they believe that, you have a better care if you're traveling abroad. We did a small study a few years ago, and we looked at the patient traveling from the UAE, and we found around 86% of the patient actually they do not need to travel abroad. It's just because they want to travel abroad. And again, there is a full government support program for this. And it's the same thing in Kuwait. Kuwait, actually, they do have an excellent oncology and also, different subspecialties. But again, it comes to the patient preference. And this is something we always talk about, in the media, about the importance for people to understand. They are having an excellent treatment in the country, and there is no need to travel abroad unless they are small percent, around 5% or 10%, that they really need to travel abroad because some of this expertise aren't available in the region.
I have to say, from personal experience, if you can avoid travelling for your treatment, then I really would recommend it. Because one of the most disruptive things was, obviously part of it was hearing that my son was ill, and the other half was, going through the treatment. But being uprooted as a family, my older boy had to leave school, and we knew the whole family had to move to London. It would have made a real difference to us if we hadn't had to move. Although you're right, there is a perspective. When you are under pressure, when you are scared, there is sometimes an instinct to try and find the very best or to go home. And you can see why the families, might choose to go abroad for treatment. Nevertheless. But it's really interesting that you say there that the healthcare provision in Arab countries is often good enough that you don't need to travel.
100%. And I tell you this from my experience. I worked in a big center at MD Anderson, which is considered one of the top centers in the US. Also, I practice in Canada, and I can tell you patients in the UAE, they are receiving the same level of care. Certainly, there are some small number of patients who require, for example, there's something called CAR T-cell, which is a very advanced way of treating blood malignancy. It's not available in the country, but it is available abroad. So there are a small number of patients, they need to travel abroad, but the majority, 90-95%, there's no need to travel, and they can be treated at home with their family being around.
Are there some countries that just aren't investing in developing their cancer care, either because they can't afford it or because their focus is elsewhere?
Yes. Actually, we had a very dedicated chapter in our book with more than 30 pages discussing the challenges for the war-torn regions. For example, you have Somalia, you have Yemen, you have Syria, you have Libya. With the burden of wars, it's definitely affecting the patient care. And at the same time, many of these countries, to start with, they didn't have a great infrastructure for cancer care. So there are two factors: poor infrastructure, and then the war in these regions affected these patients. And certainly there are many other countries as well. They're struggling with their cancer care.
What were your overarching conclusions from your research? Because, this is a serious book. Like, you've written a book on the subject. Most people just write papers. You really went for it. You went for the whole 9 yards.
The main conclusion that, if we would like to fight cancer, and I will give you a very important information, the cancer will be increasing over 300% over the next 20 years. Again, 300% increase in our region over the next 20 years. And if we don't start by prevention and starting by early detection and screening, we will be in a significant hazard of cancer, mortality, and morbidity. So we have to eat fine. We have to live healthy. We have to uptake the screening for cancer seriously. And this is the only way we can fight cancer.
So thank you so much for your time. Really interesting to get those insights. And obviously, because I've got a little bit of a personal experience there, it was personally interesting as well. Thank you very much indeed, sir.
Thank you for having me.
Thank you. Professor Humaid Al-Shamsi, President of the Emirates Oncology Society and Professor of Oncology at the University of Sharjah. Plus, he is one of the authors of that book, Cancer in the Arab World.
Keeping you updated.
This is The Agenda with Georgia Tolley
On Dubai Eye 103.8.
Right, the World Government Summit is currently taking place in Dubai at Expo 2020. The event is playing host to